the Division of Health, Wellness and Social Protection, Dr. Faith B. Israel, and the Chief Secretary of the Tobago House of Assembly, as well as the Secretary of the Division of Finance, Trade and the Economy, Honorable Farley Augustine. I now invite Dr. B. Israel to make her presentation to the media.
Good afternoon to the members of the media. First, allow me to thank those of you who've been in support of this process thus far. We have started a process that is one that is very challenging, and it is one that we want to thank everyone who has been part of the process thus far, so we would ensure that we continue doing the best that we can do for the village, for the island known as Tobago. I want to start by expressing condolences to the family of Mr. Jason Clark. Many of you may know that Jason was a member of the staff at the Division of Health, Wellness, and now Social Protection. He was fondly known to all of us as the real chairman. And it really is sad that we had to treat with his passing. Condolences to his family, condolences to his friends, condolences to everyone who knew him and loved him. He will surely be missed. The current situation as it relates to COVID-19 is one that is pretty critical. And I am the one starting the press conference today because I would like to spend a little bit of time giving an update or giving an assessment of what is happening within the health services as it relates to COVID-19. I am very aware of the public commentary that is happening. In fact, since the election, my phone, my messages have been inundated with calls and messages from our external clients, meaning patients, from our internal clients, meaning our staff and so forth, talking about how dire the situation has been. So I will reiterate. We have been treating with COVID-19 for the last 2 years or so, a little under 2 years. And it seems to have gotten worse, especially when we are looking at the numbers of cases as it relates to COVID-19 on the island. You would all be aware that the daily reports are coming out, and every morning we see the numbers. Some days they seem to be climbing, some days they seem to be going down a little bit, but overall they are skyrocketing. The fact remains, though, that we need to put systems in place to treat with those activities that are happening within the healthcare system and outside of the healthcare system as it relates to protecting our patients, protecting their families, protecting those who are loved by those who are dealing with COVID-19. I am particularly interested in ensuring that we also protect our internal clients who are the doctors, the nurses, all of the health professionals that are part of the system. Unfortunately, our facilities as it relates to health, wellness, are very close to capacity. I am not going to go into the specific details in terms of numbers, but they are in the 90s, 80s, and 90%. And what does that mean in reality? It means that as we go along, as people get more sick, we are going to get to the point very quickly where we do not have sufficient bed spaces for the individuals who need bed spaces. In that regard, we've made a decision, this decision was made quite some time ago, but it is being actioned today to include an additional facility to house some of our patients who are with COVID-19 at a facility in the lowlands area. I would like to officially thank the owners of that facility for making it available to us. I would also like to thank the members of the Tobago Regional Health Authority who've been working tirelessly to ensure that that facility is up and available for use post-haste. If everything goes as planned, we would be transferring some of our patients to that facility. Now, it's important to note that because of the location of that facility, we will be sending some of our patients who still need medical care but are not critical. So if we have a patient going down to Lowlands, it is because that patient is almost in a step down type of situation, and that patient is able to be a little further away from the critical, from the ICU services that are close to the hospital. Because of that situation, though, and the numbers of people who continue to be positive, who continue to become infected, and who continue to require medical services, it is important to know that even though we have that new facility up and running by the end of today, that if we do not take very close precautions, and if we do not continue following the protocols as outlined, then we will very closely get to the point where that facility is completely overwhelmed as well. And because of that, I am going to encourage each of you to continue following the protocols. And I think I would spend a little bit of time explaining why we are asking you to follow these protocols. The first protocol we're asking you to follow is to wash your hands. We're asking you to wash your hands with soap and water because the soap and the water is able to break the protein membrane that encompasses the virus known as SARS-CoV-2. When that protein membrane is broken, the virus dies. So I know it is very annoying that every time you need to enter a facility, they're telling you to wash your hands, but it is something that actually works according to science. Washing your hands with soap and water literally kills the virus. The same thing applies to using alcohol-based sanitizers. Of course, we are recommending that you use the soap and water or you use the alcohol-based sanitizer. If you do not have access to soap and water, use a sanitizer. A little pet peeve of mine, if you have access to soap and water, please use it. The sanitizer is a secondary type of facility that you can use. The other thing we're asking you to do very critically is to continue wearing your mask. Why are we asking you to wear your mask? Because when we speak, when we sneeze, when we cough, droplets that contain the virus come out of our mouths, and if we do have the virus, that can go into or very close to somebody else who would then get sick. That is how the virus moves from one person to the other. In a situation where you may not be next to someone, the droplets can actually go and land on, for example, the table, and that is why we keep telling you to sanitize the surfaces, because when the virus drops on the table, someone else may go touch it and then put their hands next to their mouth or their nose. We are continuing to ask you to keep your hands away from your mouth, your nose, and your eyes, because these are portals in which the virus can enter your body. So yes, wash your hands. Continue wearing your mask appropriately. Do not touch your face. Don't touch your eyes. Don't touch your mouth. Don't touch your nose. And we continue to ask you to social distance. Why are we asking you to social distance? It is because the virus within the droplets can only go so far without falling to the ground. The distance that we know the virus falls or the droplets fall is within the 6 feet mark. That is why we are telling you to social distance. Stay at least 6 feet apart, because even if you come into contact with somebody who is COVID-19 positive and they sneeze or they talk and there are droplets in the air, because of the weight of those droplets, they fall and they will not get to you if you are 6 feet apart from the person who is speaking or may have been sneezing. The other thing that we are really asking you to do, and this is critical because it is something that we've been having significant issues with, is if you feel ill, please stay at home. And I'm going to say it again. If you feel ill, please stay at home. Call the 800 HEAL number, and they would advise you on how to get tested. They would talk with you about your signs and your symptoms, and they would give advice on what to do next. We have too many people who are ill, who know that they feel ill, but they still go to work. It's also important to note that when you are symptomatic, meaning you are coughing, you're sneezing, your eyes are running, you're doing the things that allow us to know that you are sick, that is the point where the virus can move from you to someone else. So please, if you feel ill, please stay at home. Now, if we do all of these measures, if we do all of these things, we would be able to withstand the situation that's happening. What I have noticed since I've officially assumed duties as the Secretary with responsibility for health is that our healthcare system is overwhelmed. The doctors, the nurses, the wards maids, everyone who is a part of the system is complaining that they are tired, and rightly so. We've been treating with this situation for about 2 years now. Many of these individuals have not been able to take vacation. They have not been able to work normally. They have to double up on their shifts. We have a situation where they need to be pulled from where they normally work to other places. They are tired. And because they are tired, it is more likely that they will not be able to function the way we expect them to function. That's human nature. When we are tired, we don't function the way we should. And this is why we are asking you, the members of the public, to keep doing what we're asking you to do. I know we are all experiencing COVID-19 pandemic fatigue, meaning we're all tired. We're all sick and tired of having to deal with this. We're all sick and tired of having to be home. We're all sick and tired of wearing the masks that are not comfortable. We're all tired of this. But the fact remains that our healthcare professionals have been the ones that have been holding this system up for the last year and a half. And because of that, I want to sincerely thank each and every one of them. I know you are the one that is blamed most of the time. You are the one who gets the first blame. You are the ones who have to interact with people who are sick. You are the ones who have to interact with the family members of people who are sick, and they're anxious and they're scared. And you have to treat with that. I understand that. And because you've been doing this for the last year and a half, 2 years, I know you're tired, and I want to thank you. Because without you, we would not have been able to get to where we are right now. Given the situation, though, and given where we are as an island and even as a country, I have actually started reaching out to international partners to ask them for assistance. What would that assistance look like? It may mean identifying individuals who can come in, bodies, meaning doctors, nurses, and so forth, who can come in and help us actually man the system. It may mean increasing our testing capacity. It may mean increasing or improving our treatment capacity. It may mean looking at how we do contact tracing. The fact is, I'm going to continue having those conversations today and in the future. And when we've come to the point where I can make specific announcements about what we've agreed on and what we will do, those announcements will be made publicly. But I want the health professionals to know that we are working to ensure that you get some kind of relief, that you get some kind of help. I am asking, though, for individuals who may be living in Tobago, who may have been health professionals who may be retired. You may have been a health professional who is, the way you're working allows you to have a little bit of free time. You may be a health professional who is not even working in the health field because of what you do right now. You may be a social scientist who could be a part of the COVID-19 response. If you fall in any of these categories and you are willing to volunteer your time and your services, we are asking you to send us an email. Send us an email. The email is tobagohealth@gov.tt. tobagohealth@gov.tt. And in that email, we're asking you to just tell us a little bit about yourself. What is your name? What is your technical capacity? What is your degree? What is your experience? How do you think you can help us? We will then go through that list and identify those individuals who we think can help us immediately and those who we think can use to help build out the system as we move forward. So again, if you are interested in being a part of this process, please email us at tobagohealth@gov.tt. It would be remiss of me, though, if I do not continually mention the fact that another component to helping us treat with COVID-19 is that of vaccination. The fact remains that the vaccines that we have in Trinidad and in Tobago, they are safe and they work. We will be rolling out a brand new vaccination process that would include speaking closely with you, individuals who may not have gotten vaccinated. The fact remains, I want to understand why you are hesitant. I want to understand what your concerns are. And when we have that conversation, I would be bringing the necessary information to you. I will be having that conversation with you. And hopefully that would alleviate the fears or the concerns that you may have. We'll be rolling this out soon. The fact remains, though, that vaccinations are part of the larger group of protocols, the larger group of activities that we need to do to ensure that we withstand this pandemic known as COVID-19. Again, I would like to thank each and every one of you for being a part of this process. It's been difficult, I know. I am a health professional. I understand quite a bit of this, and I am also sick and tired of what we've had to do. But we need you to take a little bit more time. Don't give up now. I am also asking you to be honest, to not let your guard down as it relates to this Christmas season. I know we've been wanting to celebrate for a while. I know we've been wanting to, lime and enjoy ourselves and interact with our friends and family and so forth. But we can't do that just yet. We can't do that just yet. So I'm asking you, please be conscious of the fact that all of the protocols need to be dealt with, all of the protocols need to be followed, and don't give up. Don't give up just yet. Again, thank you so much. Thank you so much for what you've been doing thus far, and we will continue to work together to ensure that we weather this storm. Thank you.
Thank you, Assemblyman Dr. Faith B. Israel. The Chief Secretary and the Secretary of the Division of Finance, Trade and the Economy, Honorable Farley Augustine, will now address the media.
Thank you very much. Good afternoon, Tobago. Good afternoon, members of the media. I wish to address you today concerning our financial health. You heard a short while ago about our physical health. We just concluded our first executive council meeting, and truth be told, it was quite a sobering experience. By way of reporting, I wish to lay on the table certain facts for us to bear in mind. Firstly, as an island, as a THA, we have received to date our full quarterly disbursement for the first quarter of fiscal 2022, and that will be the months running to December and starting at the beginning of the fiscal year in October. And for this first quarter, we have received to date $558,750,000, with our last subvention coming perhaps a few days ago. So we have received all of our quarterly disbursements. However, I wish to hasten to indicate through this platform a plea to the central government that we will desire that you follow the law. Act 40 of 1996, with regards to how these funds are dispersed. In fact, when we look at the law requires that these funds be dispersed quarterly, and at the moment the funds are dispersed irregularly, and they are dispersed most often on a monthly basis. That's a difficult way to do business. The result of that is that the THA has had over time to use an overdraft facility with the bank in order to meet any shortfall while waiting on disbursements. It also means that we cannot plan sufficiently. If it is, we cannot regulate how and when we receive those disbursements. That overdraft facility is costing us quite a tidy sum. And of course, that adds to our recurrent expenditure, on top of which the overdraft facility is not catered for in the budgetary allocation from the Minister of Finance. So we have been trying to use this facility prudently. However, the reality is that we cannot do good business with getting our funds in an irregular manner. I must hasten to add that having received all of our first quarter disbursements, we are almost through it all in terms of spending it all. And that brings me to the next issue. Number 2, issue of unspent balances. And when I talk about unspent balances, I'm talking about monies that were allocated but have not been spent to date. And to date, as of today, the 15th of December, today's the 15th, correct? Today, the 15th of December, our unspent balance stands at $50,506,501. Let me go that again. $50,506,501. Let me put that in some perspective for you. That is not a lot. In fact, I have on my desk now requests from health for over $100 million. And when I looked at what is happening at the hospital with my administrator this morning, and I said, we have to fix this. We have to find a way to remedy what's happening with our parallel healthcare system. She said, we have to find the money. 50.5 million cannot begin to treat with matters like that. But let me put in even deeper perspective for you. CPEP and URP will take all of that 50 million plus some more. Because you may remember that the budgetary allocation for URP came in at $18 million from the national budget that was read in October. That is woefully insufficient to pay all of our CPEP and URP workers. And so this 50.5 million has to be reserved for paying their salaries. And guess what? That is not enough to pay their salaries for the rest of the fiscal year 2022. And guess what? We have already received all of the 18 million that was budgeted for URP for fiscal 2022. Why am I saying this? It's so that you understand where we are at financially. And yes, I am guaranteeing you today, if you are in CPEP or URP, I'm guaranteeing you that we will find the money and we will pay you and we will keep you on the payroll, because I believe strongly that those who are most vulnerable must be protected the most. So you will enjoy a level of protection from us. But unspent balances usually also provide a buffer for development spending. You may have a development project and it may go a little over budget, or you may have an emergency and you need to pull from it and so on. We do not have that luxury at all. It does not exist. And then thirdly, you may recall that we boasted about the $163 million of bond financing that we received. We were to get somewhat $300 million, but we got $163 million sometime in May. Guess what? In less than 6 months, every single cent of the $163 million was spent. All of it. And I have since requested a list of all the projects that this money was spent on. and all the people who benefited from this $163 million. But all were spent, and we don't have forthcoming just yet a priority list upon which this $163 million was spent. I will also add that in order to get the rest of the bond financing, we have to go back to the Minister of Finance and appeal to him to allow us to borrow the rest of the bond financing. Additionally, we have to negotiate some more with the bank to get the additional sums. We also have to look at debt management, because it's not free money, it's money that we have to pay for and pay at an interest for. And so naturally our recurrent expenditure is increasing. We have used out all of this $163 million. It is difficult to pinpoint the kind of priorities this $163 million was spent on. But in less than 6 months, we used up all of the $163 million bond financing simply because we were in an election year. We were promised prudent restraint in how we spend. We were promised that given that we were drawn at 6-6 in the last THA election, and we had no House, no Public Accounts Committee, no way of scrutinizing the expenditure of the THA, that there will be prudent restraint. The complete opposite has happened to prudent restraint. So that $163 million bond financing, all gone completely. Finally, contingency fund. Now, there's something called the fund account. And what happens is when monies are dispersed from Trinidad, they go through the fund account before being allocated to divisions. In the contingency fund, we are to store at the end of fiscal year any money is not used, any money not yet allocated. We tend to store all of them in the contingency fund. And it's called a contingency fund because it's where we go to for an emergency. There's a hurricane, we go. There's an earthquake, we go. We have used from it to bail out CPEP and URP before. We have a medical crisis, we can go. Contingency fund. I'm giving you the balance on this account as at December the 15th, as of this morning. The balance on this account as of this morning is $392,000, $543.88. That's $392,000, $543.88. That is almost zero. Now, in the past, what has happened is that we had a healthy contingency fund balance that we will always bring forward from year to year, from fiscal year to fiscal year, from quarter to quarter. I know because I've been in the House for the last 5 years. I've seen the financial statements that are laid in the House on a monthly basis. And the contingency fund account tends to have a healthy balance. Again, this is to treat with emergencies. We cannot even afford an emergency in Tobago. That's the reality. And to be honest, I feel as though people were deliberately fiscally irresponsible simply because people felt that they needed to spend what needed to be spent, to get an advantage in an election. I want us to have a political culture where we are not driven so much by elections, but we are driven by service to people. When we look at how we manage projects over the last 6 months, the haphazard manner in which we were paving roads, no set priority, the roads that needed critical repair were being ignored in favor of roads that we felt would give greater political mileage. When we look at the fact that we were just trying to open projects left, right, and center, that we had an unfettered approach to spending all over the island. This is the result of that. But you see, if we are driven by a desire to serve people and a love for people, this will never be the situation. This will never be the case. But I did not bring this information so that you will leave and have the worst Christmas ever. Because if ever there is an executive that is ready and available and has the capability to treat with this kind of mess, it is the executive that I now lead. And so I wish to, at the same time, give you a measure of confidence that we will fix this. I wish to, at the same time, to say to you in no uncertain terms that we will get very creative. I spent the last couple of weeks telling you about how we need to build out a robust private sector. This is forcing us to do that more than ever before. It's forcing us to call upon the private sector at home and abroad to invest in Tobago and to invest in public infrastructure too, in ways that they can earn from it. And that's not uncommon at all. You go to Jamaica, their toll road is being managed by a company who built the Highway 2000 for them. Jamaica did not have the money to build such an expansive highway network, but they got it built through the private sector. You go to some other territories, airports are being built by the private sector, but the state is retaining security functions and certain elements. We have been talking this public-private partnership model, but we have not really done it. We have to do it now. We have no choice, because what we have in terms of what is left for us to spend will not allow us the luxury of the THA or the state doing it all on its own. We have to get creative. We also have to use this opportunity to urge Tobagonians that we have to get even more productive. We have to dig in our heels and work even harder. We can't get out of this. We can get out of this. And the reason for sharing it is not to be facetious. It's not to be vindictive. It's not even to point fingers. The time will come for pointing of fingers. If I wanted to point fingers, I would have spent a significant chunk of this press conference calling out the names of those who helped wasted the 163 million. And I'm saying the time will come to hold people to account for this kind of fiscal irresponsibility. But as of now, my job is to inspire you and to give you a measure of hope in saying that we can do it. The Tobago that we all grew up in is a Tobago where we know how to cut and contrive. We always knew how to take little and to make plenty with it. You have among the leadership people who came from poor families and who made it through university. Many of you live in nice homes and well-appointed homes now, but look back over your own life and see what it took for you to get there. You purchase your pallet of bricks month by month. You purchase your cement little by little. You use the land hand and you did the work and you built out a nice home for yourself. Why am I sharing these anecdotes? I'm sharing it because if ever there is a people with the capability of taking this kind of mess, fixing it, and being able to build out a developed society, it is Tobago. And so I'm calling on all of you, our collective minds, our creative geniuses, to ensure we fix this. This means that the Exec Council has had to take some hard decisions, one of which is we have had to pause on some contracts. We have had to also pause on some of the hiring. We have had to make a decision to only keep that which is necessary in terms of some of our operational costs. We have had to take the decision to review the countless boards and committees that we have and to see those that are well worth their salt. We have had to look at how we are leaner in our practices. It means that you will come to many THA functions over the next fiscal year and there will be no tea plates there for you and no juice to drink, no food and no entertainment, because we just have to cut costs where we can, because we have to get to a place where we have to secure our employees, all of our employees. We still have people we are owing gratuities, and Dr. Faith spoke about those hard-working workers in health, many of whom are owed gratuities and increments and so on. Education is another division. We have to secure these payments so that workers can feel motivated to keep working. and we are going to prioritize. I've asked each of my divisions to sit and to create a priority list of five main projects for the fiscal year, this fiscal year. Just 5, not 100, not 20, but 5. Prioritize the most important ones as we begin to manage what we have. I wish to thank the public servants who have been extremely helpful and getting this kind of information to me in quick time, overnight, in the morning. And they are working around the clock with me in ensuring that we can remedy this situation. We will work on addressing all the issues I've raised, the issue of the disbursement and getting it quarterly. I will dispatch a letter tomorrow to the Minister of Finance to that effect. And I'm also seeking an audience with him because we have to look through the matter of the bond financing. The unspent balances, it is what it is. We're securing our CPEP and URP workers because they are vulnerable and they have to be secured. The contingency fund, we will build it back up. That is our equivalent, our local equivalent to HSF, a Heritage and Stabilization Fund. And so we'll work on fixing this. But in the meanwhile, we need all hands on deck. Dr. Faith made a call for volunteers, and we are going to approach a lot of our practices using a similar approach, bringing everybody around the table to participate and to help us build out our economy. To the private sector, there is work for you to do, and there are opportunities for you. Trade is now a part of the mandate of the Division of Finance and the Economy, and so we are going to work extremely hard in getting those FDIs in, those foreign direct investments in, and also getting grant funding for some things and bringing the diaspora back here to invest in Tobago. There are things that can be done, while at the same time securing the employment of all our workers. But I needed to let you know what the situation is. I was hoping to wait until January to go through in detail with you our finances and to present a budget statement to carry us through the rest of fiscal year 2022. But I had to give you a cursory glance today of what we have so you will understand what we're working with and you will understand where we will be taking Tobago from. So in 4 years' time, when the story is told of what we have been able to achieve, you will understand the kind of work we had to put in to get this island there. Thank you.
Thank you, Honorable Augustine, Chief Secretary of the Tobago House of Assembly. Members of the media, you are now allowed to ask questions. Remember, once you have a question to pose, just indicate by raising your virtual hand. Elizabeth Williams, TV6 News. Good afternoon, Elizabeth.
Good afternoon, Davia, and good afternoon, Mr. Chief Secretary.
Good afternoon, Elizabeth.
Good afternoon. I'm hoping you're hearing me.
Okay, we move to Candace Jackson of Tobago Updates. Good afternoon, Candace.
Good afternoon, Chief Secretary and Secretary of Health. Good afternoon. Are you guys hearing me? Good afternoon.
We're hearing you now, Candace. Good afternoon.
Great, thank you. So my first question is for the Chief Secretary. Seeing as how he painted a picture of a not so good financial situation in the Tobago House of Assembly, then what is to come of the promise of ex gratia payments that was made right before the elections to public servants? And also, as you all pointed out, there needs to be at least $100 million to take care of some of the gratuities and so on within the Division of Health. Is there going to be any attempt to approach the Minister of Health for the additional funding? Because I know there was a situation where when COVID-19 started where there is money available if the THA wanted it. So based on request, it would be granted. So is this a consideration for the new assembly that they will also be approaching the Minister of Health to draw down from that fund to supplement some of the shortfalls you guys are experiencing right now? Thank you.
I thank you for your question. With regards to the ex gratia payments, I asked the administrator and the technical officers in finance to look into what is possible. One of the things I did say on the campaign trail is that we would love to give the ex gratia payment to all of our workers. It's not uncommon. In fact, I've seen some Caribbean islands double the salaries at Christmas time for their workers. I've seen some islands do it 2-3 times in a row. So it's not uncommon at all as far as the CARICOM regions are concerned. But I made a point on the campaign trail that it will be as funds are available. And I've asked the technical folks within the division to look at what is available. Looking at what we have available now and what we're seeing here now, it now makes sense what my predecessor was saying about us not being able to afford this kind of thing. And that's because he was well aware of the kind of damage they were doing to the Tobago House of Assembly's treasury. With regards to your second question, yes, all options are still on the table, and that includes speaking with the Minister of Finance, as I indicated I intend to do, and the Minister of Health, as has happened in the past. But all options are on the table. And let me hasten to add that now is a good time to see the testing of the relationship between the both islands, especially since it was the brothers and sisters of those in power at the central government that has caused this kind of untold damage.
Elizabeth Williams, TV6 News. Good afternoon again, Elizabeth.
Good afternoon. Hope you are hearing me now.
Yes, we are hearing you.
Okay. What I wanted to ask is, with respect to what the Chief Secretary announced this afternoon, Mr. Chief Secretary, are you looking at calling in the police to do an investigation? And are you also looking at an audit into the finances of the Division of Finance? And my other question is, were you surprised by the coffers of the Division of Finance when you looked at what was available at this point? Were you surprised at all?
Let me start with the last question. Yes, I was surprised, because knowing what we had going into January, and given that we were given the commitment that there will be prudent restraint, even with all of the road pavings and so on that did not happen in a systematic way, I thought there had to be some stuff in the kitty. At least there must be sufficient stuff there. That is not the case. But we can't cry over spilled milk. It has happened. We have to pivot and find a way to move on. And that's what I'm saying to Tobagonians. My role in telling you all of this is so that you understand where we will all be working from. To your first question, the question of auditing, most definitely. I've already signaled to internal audit to start working in some particular departments. But in some other departments, we have to bring in external auditors to do an assessment of what was done. Some of the things don't require audit because we could see clearly what the monies were spent on and what happened there. In terms of the police, let me assure you that what warrants police intervention will get police intervention. We're not going to waste time where this is concerned. In fact, if something warrants police attention, I wouldn't even come here to mention it. It will just happen that way. Let me put it that way for you, because we have to be serious about the finances of the people of Tobago.
Clayton Clark, freelance reporter. Good afternoon, Clayton.
Hi, good afternoon to Mr. Chief Secretary and the Secretary of Health. My questions, Mr. Augustine, you mentioned in the disbursement of funds from the central government that is it was irregular, and you were explaining that the funds came on a monthly disbursement. I just wanted to just clarify that. Is it that the monthly disbursement that is how it's not supposed to be? Just clarify that one. That's my first question. And my second question is for the Secretary of Health. Of course, COVID is dominating the health sector at the moment, but how are the other areas of the health sector coping or getting attention. I mentioned that because non-essential surgeries have been put off for quite a while, and some persons whose surgeries or cases were non-essential have become critical right now. So your comment on, those two issues, both Chief Sec and Secretary of Health. Thank you.
I thank you. Let me be very clear. Act 40 of 1996 that governs the THA says that the disbursements from the central government should come to the THA on a quarterly basis. Quarterly, a quarter of 12 months is 3 months, which means 1, 2, 3. January, February, March, 1 quarter. A quarter is 3 months. So monies are not supposed to come this month and then come the month after. Monies are supposed to come quarterly. We are supposed to get our disbursements on a quarterly basis. So at the beginning of the quarter, we are supposed to get the disbursements for the entire quarter, which will allow us to plan, which will allow divisions to meet any emergencies, and which will reduce the need for us to use our overdraft facility as often as we do. We just need to follow the law. I'm not sure why it has not been impressed upon them before, central government that is, to follow the law, but I'll be impressing upon them to follow the law. I don't think I will have to go all the way to court to get remedied, because I think we are all mature people and we have the best interests of Tobago at heart. And I think all that is required is a discussion about how we get back to the place of following what the law prescribes. Because we used to do that once upon a time. I believe there might be some cash flow issues with the ministry in Trinidad, and so that has altered the disbursements. However, it cannot be at the detriment of the business of the THA. So we have to have a discussion and work out an amiable solution to the problem. But the law, Act 40 of 1996, requires quarterly disbursements.
Clayton, I understand your question, and I am fully aware that there are what seemed like non-essential services that have now become critical. I have actually spent the last week or so doing a comprehensive assessment of the healthcare system. And one of the things that we identified was the fact that if we do not get a full grasp, a serious handle on the COVID-19 situation sooner rather than later, we would not be in a position to do anything about the non-COVID related illnesses. So my aim this afternoon and my aim within the next couple of days is to really figure out what are the resources that are available to us to ensure that we get a hold of the COVID-19 situation. And when that happens, we can go back out to having quote unquote normal services again. I actually had several conversations with professionals, and we agreed that if we continue trying to run the two systems the way we tried, we would prolong the delayed coming back to normal. So we need to get a grasp of the situation right now, hold on to that, bring it back to some level of control, and then we can say, let's go back to the clinics, let's go back to the elective surgeries, and let's go back to the other services that are necessary. If you are in a dire situation, though, because this is critical, if you are someone who needs emergency care, I am encouraging you to definitely call the health facilities, because the other thing that we've experienced, and probably understandably so, is that people really are afraid to call on our emergency services because they are afraid of what is happening up at the hospital. So what we need to do is ensure that we rectify what is happening there so that we can go back to normal. If you need emergency care, do not hesitate to call. If you need emergency care, do not hesitate to call. But we're asking you just to give us a little bit of time to get this under wraps, to get this back under control, because the numbers and the projections that I am seeing, if we continue to allow it to snowball, January is not going to be as rosy as December is, unfortunately.
Caricia Douglas of TTT News. Good afternoon, Caricia.
Good afternoon, David. Good afternoon, Chief Sec and Dr. B. Israel. I just have two questions to Dr. B. Israel. Just for some clarification on the space at Lowlands that you all will be utilizing to house patients who are not critical. I know you mentioned that you thank the owners for allowing you all to use it. So is there a cost attached to utilizing this space? If yes, what is that? And secondly, with regard to the healthcare workers, we know on the onset of the pandemic, nurses were hired. And they had, I know Mr. Augustine mentioned this before, they are on contractual agreements where they don't have the provisions such as sick leave. Have you all been looking at this, and what are your plans? Thank you.
Certainly. So my understanding is that the building was actually loaned to us free of charge, and that is one of the reasons I thanked the owners. We just needed to spend the money that is necessary to do the outfitting and to ensure that it is retrofitted in a way that makes sense for what we will be using it for. So that, again, I want to thank the owners of that building. As it relates to the nurses, we have an overall HR issue within our healthcare system, and it is one that will take an overall look and an overall assessment and an overall strategic plan to get it correct. And that is why what I'm asking for right now really is for the healthcare workers to allow me almost a little bit of time to get the system on solid footing, and then we can treat with all of those additional issues. I know that they're tired. I know that it makes life very difficult for them, but what we need right now is to get us on solid footing so that we can rectify those issues in the near future.
And maybe I should make an input here to indicate that one of the reasons for bringing on Mrs. Sertica Williams Orr and to giving her specific responsibilities for public administration, labor and planning is to begin to build out a roadmap for how we will address your issues. Because I take on offense on behalf of a long time, be able to properly remunerate them and fix their contractual issues. I do not want the doctors or the nurses that are attending to me to have to come to work frustrated and demotivated by the fact that they cannot get what is rightfully theirs. It's not that it doesn't belong to them. We're not doing them a favor. It's what we as a society owe them. And that's why when I saw this sort of a grim financial outlook, it broke my heart, because there are people like those working extremely hard across in healthcare that deserved perhaps some of that $168 million of bond financing, that deserve some of the contingency fund monies that were spent on God knows what, that deserve some of the unspent balances that we have had dwindled to just $50.5 million. We have done them a disservice. And that's why correcting the system now is critical, because we have to, by the hook or the crook, find a way to remunerate properly our workers with what we owe them. And I assure you, Mrs. Williams Orr has already begun looking at these employment issues and is looking at building out a roadmap from within the office of the Chief Secretary, from right to the top of the Executive Council, in such a manner that will facilitate you getting your monies and what we actually owe you in terms of benefits.
Camille.
Secretary. First question to Madam Health Secretary. Is failure of our healthcare system imminent? I'll tell you why I asked that. In addition to all the calls from healthcare professionals and the patients and their families at the hospital, there was a situation this morning where a man fell in Scarborough and he died. He was there for more than an hour, and by the time Tobago Channel 5 had left, he was still on the ground awaiting a doctor to pronounce that he had died. Two, our resignation, this is to Mr. Chief Secretary, our resignations from board members forthcoming, because we're hearing of situations where some board members are saying they're not resigning, they're waiting on you to tell them exactly what to do. And thirdly, did you respond to the AG's second letter concerning your Deputy Chief Secretary, Watson Duke? Thank you.
So I would start by indicating that the situation is dire. The situation is dire. And I'm going to say it one more time, the situation is dire. And that is why I've actually reached out for international help to see where we can do that surge capacity to ensure that this system does not completely crash.
And to respond to your questions, the issue of board members resigning, yes, in some instances, entire boards have resigned. In some instances, partial boards have resigned. In some instances, no member of the board or committee has resigned. And I'll say it again, the democratic principle, the legal principle also is that once there is a change of government, even if the government was changing hands within the same political party, all boards and committees are naturally expected to hand in their resignation. And that's because the operation of these boards and committees hinges upon directives from the executive. They are extensions of the executive. Legally, we can be impolite and just simply abandon the boards and send them letters and dismiss all of them. But I like to be polite first. And I promised to be polite politically first. So I am giving people time. You know, some folks perhaps couldn't find a printer or they couldn't send an email, the internet weren't working. So we're giving them some time, right? We're giving them a little time. And I expect that by next week, we will get to a situation where we could fully build out the government of Tobago the way that the people of Tobago has mandated us so to do. With regards to the issue of the AG letter, the truth is both letters from the AG only arrived on my desk this morning. I did not get them before this morning. I understand that it was sent to the Assembly Legislature, to the Clerk of the House, but I did not get them until this morning. The issue of whether I will respond or not, the truth is the Tobago House of Assembly does not answer to the Attorney General. The Tobago House of Assembly is a semi-autonomous body, and we definitely do not answer to the Attorney General. I will add that handsomely, multiple millions for in rental. So, Hochoy Charles, yes, I'll take some advice from Hochoy Charles. He's Tobagonian, and by right can give me, or anybody from Tobago that matter can give us advice. The AG, not so much. But I assure you that the election, not appointment, because a Deputy Chief Secretary is not appointed, a Deputy Chief Secretary is actually elected by the House. That the election of the Deputy Chief Secretary is in order, and the Deputy Chief Secretary has already indicated by way of resignation letter to PSA that effective the end of this calendar year, he will no longer be with the Public Service Association. And I believe that that is sufficient time to allow the Deputy Chief Secretary, to be able to sever ties with the PSA and transition into additional roles with the executive of the THE.
Cassandra Thompson, Forbes, I-95.5 FM. Good afternoon, Cassandra. Good afternoon, Cassandra. So we're not getting any audio from Cassandra, so I'll move on to Candice Jackson of Tobago Updates. Hello again, Candice.
Hi, good afternoon again to the Chief Secretary and Secretary of Health. My question is just a follow-up from Camille's question in regards to the situation with Mr. Duke and what the AG is saying. Now, one of the things that the AG is saying, and as well as some other persons, is that this grace period, or Mr. Duke is not going to resign fully until the end of the month. But persons are saying that the grace period should not even be applicable in this situation based on his election. What do you have to say to that notion? As well as, I know, Dr. Faith, you said earlier that there is that attempt to get volunteers from either the diaspora or within Tobago to help out with the health system. But how soon do you expect these persons to be able to come on board and to be able to turn around the system? So you have any sort of timeline as yet as to when we can see things making a turnaround in Tobago, especially where the attention to COVID-19 is concerned?
Well, it's not an issue of a grace period. The law is clear. You cannot receive remuneration from any other place or benefits from any other place if you are a member of the executive of the Tobago House of Assembly. Once Mr. Duke is not receiving any remuneration anywhere else, he can legally be a part of the Executive Council as Deputy Chief Secretary. Full stop. That's the law. So it's not about a grace period. What I have done is that I have, Mr. Duke was elected as Deputy Chief Secretary, and for the first time in the history of Tobago, the Deputy Chief Secretary will carry a standalone division and will not have anyone else attached to that division. Now, we have never had that before. So it means then that what Mr. Duke has at the moment is the portfolio of Deputy Chief Secretary, but he does not have an administrator assigned to him. He does not have workers assigned to him. He does not have divisional offices yet assigned to him. And so his function is almost very titular at the moment. And that's one of the reasons why Chief Secretaries past have always assigned additional portfolios to that of the Deputy Chief Secretary. I've made myself absolutely clear that I would not give him additional portfolios because that will require that public service staff now be attached to him and his portfolio. And for that to happen, there will be some obvious conflicts of interest. Not illegal, but unethical. There's a difference. And so where he's at the moment is a legally safe place for him to be. He adhered to my proddings. He has resigned effective the end of the year. And that's why I say that that's sufficient. And when we cross over into January, we can treat with any additional portfolios or functions that I would like the Deputy Chief Secretary to play. But note that the law is very clear. The law only recognizes conflict insofar as receiving remunerations and or benefits from another organization. Let me give you an example. I am still the Vice President of CIDES. Should I resign as the Vice President of CIDES? Because we have a THA that has community development and youth development and sport. Should I? No. Legally, that's no bearing. I'm not being salaried as CIDES Vice President. I'm a volunteer there. And so the law looks specifically at a member receiving remuneration and or other benefits and pointed out that if that is the case, you can't be in the executive. Once Mr. Duke is not receiving remuneration and or other benefits at the moment, and I'm satisfied that he is not, then he can legally be the Deputy Chief Secretary. So it's not a matter of a grace period. That window is a window for him to wrap up things completely with PSA before me deciding to move his portfolio beyond the titular sort of arrangement that he now holds.
The issue relating to how soon this will begin is almost immediate. I've actually already started getting emails from individuals who are interested in participating in that volunteer service. I have also started chatting with the CMOH's office, with the medical chief of staff within the TRHA to work out how we could use the individuals who possibly come forward. So as soon as we get access to the list of individuals who may be available, then we would start building that out immediately. If you're asking about international individuals who may be coming from outside of Trinidad and Tobago, there are provisions, if they are medical professionals, if they are doctors, to get a special provisional medical board authorization. That is actually something that we've already worked out. So it's just a matter of identifying who and triggering that process. I am actually on our way to meeting with the international bodies soon, right now within the next 5 minutes. So that is why we are going to be wrapping this up very quickly, and hopefully coming out of that meeting, I would have more to bring to the table in terms of exactly when, who, what, when, and why.
So on that note,
just before you close, I just wanted to make the point though. I noticed the postings on Facebook, the breaking down of the parallel healthcare system. I've already indicated to the Secretary of Health that I will be making a surprise visit to the hospital. It's still a surprise because you won't know when I'll be coming. I'll just be showing up at the hospital to see what's actually happening there on the ground. But that is extremely concerning to me. I have received several calls from individuals who are not well, not even COVID related, but struggling to get some assistance, and that is not good enough. I wish Dr. Faith's advice from a year ago, 2 years ago was taken, because we would have had a functioning parallel healthcare system. That, as it appears now, has broken down, and we're working post-haste into fixing it. We will just have to fix it somehow or the other, find the resources to fix it. But we cannot have residents struggling through the healthcare system as they are, and people just sitting outside on the floor and on benches and just waiting for service in an inordinately long period of time. But at the same time, if it is that you don't need to be at the hospital, then don't go, right? And take care of your health. Please, if you know you have issues with diabetes and hypertension and a history with heart failure, take care of your health. Now is not a good time to eat all the studongs in the world and all the provisions in the world and all the salty foods in the world. Perhaps you need to leave the pigtail alone for a little bit. Perhaps you need to just watch your diet, exercise. You are allowed to exercise because you have to take some responsibility for your own health to avoid clogging the system even more. So I urge you, as we sift through the mess we have inherited, I urge you to take good care of your health, but know that we are working on an emergency kind of basis, trying to remedy the situation. So thank you.
So on that note, that's how we wrap up this week's Post-Executive Council media briefing. Thank you, Dr. Faith B. Israel and Honorable Fali Augustine, Chief Secretary of the Tobago House of Assembly, for your presentations. Thank you, members of the media, for joining us, and thank you, our viewing audience, for tuning in. I'm Davia Chambers saying do have a wonderful remainder of your afternoon.